Health officials with the CDC say it's not a matter of if, but when a coronavirus outbreak hits the U.S.
Don't panic. There are simple things you can do right now to help prepare. The Department of Homeland Security says stock up on medicines for yourself and your children, like pain relievers, cough and cold medicines, even medicines for upset stomach, and don't forget those fluids that contain electrolytes.
Government officials also say make sure you have a supply of any regular prescription medicines you might need.
And don't forget, it's important to store a 2-week supply of food and water.
That means canned and non-perishable food and enough bottled water for everyone in your family. Some experts suggest stocking up on soap, detergent, and baby supplies to last at least a month. That way you have what you need if there's any disruption to the supply chain.
And if you're often out in big crowds or you ride public transit, consider carrying wipes or using a disinfectant spray with alcohol. And use it often.
And what about masks? We found some online vendors jacking up the prices, preying on people's fears. This seller peddling a box of 10 masks for $299. And this person hawking a 10-pack for nearly $700. But do you really need to stock up?
I'm here with Dr. Natalie Azar. Dr. Natalie, what's the bottom line on masks? Are they helpful?
So, Vicki, the bottom line right now is that there is no recommendation for anybody in this country to wear a mask to protect them against coronavirus unless you are exhibiting symptoms yourself, are sick, or are taking care of somebody who is sick.
Dr. Azar says the N95, a specialized mask, does protect against the coronavirus, but the CDC recommends preserving those masks for frontline healthcare workers.
Should you worry if you can't get one of these N95 masks?
Unless there's a widespread community outbreak, this is not something that Americans necessarily need to have.
And another thing, health experts say some people have overreacted, avoiding Chinese restaurants and businesses out of fear that is baseless. Coronavirus is spread by saliva, coughing, sneezing, or direct contact with people who are sick.
At the end of the day, what is the number one thing you can do to prevent yourself from being sick?
Right now, I think the number one thing that people need to do, which we tell people for flu anyway, is to wash your hands. And we mean 20 seconds, really scrubbing. That's how the germs are going to get off of you.
And Dr. Azar says if you develop a dry cough, fever, and shortness of breath, don't wait. See your doctor.